This community update was brought to you by U Radio. Mental health care access continues to be a significant need for youth. According to a report released by the Canadian Mental Health Association, youth are not receiving appropriate mental health, addiction, and substance use health care, particularly in rural and remote areas. The report identifies suicide as the leading cause of death for youth ages 10 to 17, with the suicide rate among Indigenous peoples 4.6 times higher compared to the rest of Manitoba. Child poverty is a significant concern for the CMHA, with Manitoba leading in child poverty rates among the provinces. A considerable portion of Winnipeg's Indigenous and racialized communities are affected by poverty. CMHA acknowledges that access to services is a significant barrier for those in rural and remote areas and those experiencing poverty. Grassroots organizations play a key role in meeting some of these needs. Huddle is an initiative centered on a youth-serviced approach, creating a welcoming and safe space where youth can seek help. Levi LaBelle, Huddle's youth service manager, says conversations with funders and community partners are ongoing to expand its services outside of Winnipeg and Brandon.
Most of my family is from a very small rural community south of Winnipeg, and I can say you wouldn't even see your closest neighbor, let alone a service for a very long ways. And so we know that accessing supports in those areas, especially where there's a lot of isolation, is really key. There is conversations that are happening. We work with our backbone team at the United Way, who helps us to have those conversations with community partners but also funding partners. I know that there's a lot of active conversation right now about how can we expand this to other places, how can we scale this initiative up and find ways to reach more youth across the province. That's an ongoing conversation. We're always looking for those opportunities just finding ways that we can make that happen.
Huddle's model empowers youth to take control of their mental and physical care. LaBelle explains that it is a priority for the organization to create a safe space where youth are comfortable opening up and seeking support.
Often these spaces where people would go to ask for those supports are in a school, right? So that can be intimidating. I have to go and talk to a guidance counselor who might be connected with my parents and tell my parents what's going on. Or I have to access a formal service somewhere in community, which means I would have to ask my parents or ask a caregiver to help me get there potentially, because transportation is always a huge barrier to accessing services. And then once I get there, then I'm going to have to talk to another adult, and it's probably going to be a receptionist, and they're going to maybe judge me about it and ask me a whole bunch of hard questions that maybe I don't even know the answer to.
That's where Huddle started, officially 3 years ago as of December 13th, 2024. Recognizing that the way services have been designed traditionally doesn't meet the needs of youth, Huddle took a different approach.
How do we create a service that's going to benefit them? And that's what we asked youth, actually. And so we started with a youth advisory before we had doors, before we had a program plan. We were just a dream and a concept around those sort of pillars of service. We knew that we wanted to offer those things and that those would be really key, but how do we bring that together? And so we got youth together and we said, what should this look like?
These conversations are built on trust, where input is actively sought from the youth. Youth are involved in every step of the process, providing feedback on everything from the color of the walls and furniture to the design of programs and policies. Their input has shaped all aspects of the initiative. According to LaBelle, the Huddle model has helped to connect with youth better and understand their experiences. It allows Huddle to provide support through its 6 pillars of care, ranging from mental health programs, movie nights, or as simple as offering a safe space for youth to connect. Huddle also offers cultural support, ensuring there is a space for individuals to reconnect with their culture. Some ongoing challenges LaBelle and others have heard include physical and mental health issues exacerbated by the pandemic, the winter season, and housing instability. LaBelle says many young people, particularly those without a stable home, struggle with isolation, a lack of social connection, and increased anxiety or depression. Basic needs like food, sleep, clothing, and shelter remain central to addressing their well-being.
We're meeting youth where they're at, really asking them what is it that's bringing you here today. Where do you want to start? What is the one thing that if we changed it right now that would make the biggest difference for you?
A sense of community is equally important. David Ness is a mental health counselor at the University of Manitoba. One-on-one counseling services are available for students, but Ness says they've seen tremendous success in their group programming. He explains community is one of the most potent tools a student can have.
One of my things I encourage all people to consider, yourself too, is when you think of counseling and mental health support, try to be open-minded to the modality. Because I think most people think of just the one-on-one counseling arrangement. And most people prefer that. And I get it. Not just students, non-students, everyone. But research shows that that's not the most effective way to get help for a lot of difficulties. Like most anxiety difficulties, the research says that group treatment is superior to individual treatment. So consider those modalities too, because the students who do go to groups and workshops find them really helpful and rewarding and rate them very highly, but there's reluctance, right? And I get it, but just try to, when picture that support, picture it coming in multiple ways.
Ness notes that one of the first places students will go when they require help is to their community, and that community supports them in many aspects of life.
One of the strongest indicators of post-secondary academic success was that a sense of community on campus. The students who had a sense of community tended to do well with better with their performance than students who did not.
Huddle believes community and connection are core to making Huddle's locations feel safe and comfortable. Many volunteers and staff have lived experiences with the challenges the youth coming in for services face, and many have participated in Huddle's programming themselves.
Having a space where folks can just sort of come and explore what's possible, to come in and first feel comfortable and just feel like, this is a space where I can just be me and determine whether or not this is the place I want to even have those conversations or ask for help, is so important.
Like many organizations, funding is always an ongoing challenge. LaBelle says they do the best with what they have and work with community partners to find innovative ways to do more. Beyond monetary support, LaBelle says food donations, warm clothing, or menstrual products are always welcomed. For anyone interested in volunteering, LaBelle encourages them to reach out, as many Huddle sites are always happy to provide a tour and talk more about how the community can support youth. You're listening to U Radio, where diverse voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.